Good evening, everyone. Today I'm going to speak about visual outcomes of phakic toric intraocular lens for the treatment of myopic astigmatism. Coming to the background of my study, patients with high myopic astigmatism usually have limited options for the surgical correction of their refractive error. Corneal refractive procedures like PRK and LASIK are usually constrained in terms of keratometry and also in corneal thickness and for ablation, and preferred candidates for such procedure would be only mild to moderate myopic astigmatism patients. Well, in case of high myopic astigmatism patients, over-ablation of the cornea can lead to postoperative complications like corneal ectasia and higher-order aberrations. So in such patients, phakic toric intraocular lens is an alternative which decreases the need for a second surgery, and initial results showed improved visual acuity with a safe and predictable outcome. However, very few Indian studies are available in this regard. With this background, I go to the aim of my study to report the visual outcomes following surgical correction of myopic astigmatism using a Vision toric implantable collamer lens. Methods: it's a retrospective study and a single center study. Patients who underwent this procedure by a single surgeon during a period of 2 years were included in the study. Other included criteria included age 18 years or more, myopia ranging from -3 to -20 diopters, aqueous depth more than 3 mm, and above age-adjusted endothelial cell density. And any other ocular pathology other than the myopic astigmatism have been excluded from the study. Preoperatively, we measured a number of things, an axial length, white to white value, keratometry, aqueous depth, lens thickness, and etc. And postoperatively, each patient was evaluated on day 1, first week, 1 month, 3 months, 6 months, and 12 months postoperatively. And at each visit, we measured intraocular pressure, uncorrected distant visual acuity, corrected distant visual acuity, manifest refraction, and subjective symptoms like dry eye or glare in halos. Coming on to the results, 54 eyes of 31 patients were included, and mean preoperative spear was about -8.64 preoperatively, and cylinder was about -2.49. And postoperatively at 12 months duration, the mean spherical equivalent was about -0.22, and mean cylinder was about -0.69, showing that 94% and 89% of the patients achieving within ±1 diopter of target refraction, respectively. No surgical complications have occurred and no additional procedures were performed. Patient reported dry eyes were very minimal, and only one patient had chronic dry eye at 12 months duration, 12 months interval. And similarly, glare and halos were also less, and it was about 15% at the end of 12 months. Coming to the graphical representation, if you represent the preoperative corrected distant visual acuity with postoperative uncorrected distant visual acuity at 3 months and 6 months, we can clearly see that uncorrected distant visual acuity at 12 months was of 6.6 or better in about 84% of the eyes. Similarly, if we take the similar plot in case of refractive astigmatism preoperatively and postoperatively, about 89% of the patients achieved within ±1 diopter of target refraction, which shows that the procedure has good predictability. Coming on to the discussion, as per in previous studies, our results support that the toric ICL is a safe, effective, and stable option for patients with myopic astigmatism. In our study, we reported 94 and 89% achieving within ±1 diopter of refraction. Similar studies were, these results were supported by FDA clinical trial and also Camia et al. Study. Coming to the conclusion, toric ICL is a safe and effective option for patients with myopic astigmatism who seek surgical correction. Patients achieved markedly improved uncorrected distant visual acuity with single surgery with stable vision over time and minimal adverse symptoms. However, we have some limitations in our study because number one being the data was utilized from bilateral studies when available to maximize the sample size. Most of the biometric data was taken preoperatively, so there was no analysis over time and no analysis of postoperative angle structures or stability of vault or rotational stability of the ICL. These are my references, and thank you very much.
So what technique you used for marking this axis?
Marking axis preoperatively, we used a slit lamp marking, sir. 0 and 180 were marked, and once on the surgical table, we have marked it with pre-inked surgical table.
Did you try to check post-operatively the placement of the toric ICL?
No.
At 1 month or at
No.
1 year? Because ICLs are more forgiving. Even
Yes.
with the mild rotation, they present with a lesser
Yes.
astigmatism
Yes.
post-operatively. It's reversed from the cataract,
Yes,
toric
yes,
cataract.